The province is extending its mask mandate for high-risk settings until June 11th. Masks are still required in hospitals, long-term care homes, shelters, and on public transit, even though the rules were relaxed in other settings, including schools. It comes as the federal government eases the border rules for fully vaccinated travelers. Joining us live tonight is Executive Director of Social Medicine at University Health Network, Dr. Andrew Boozary. Dr. Boozary, first I want to get your thoughts on the announcement today extending the mask mandate for high-risk settings. Why is this so important, particularly for these environments?
Yeah, it's definitely important from what we've seen, in terms of the last few weeks. If you look at the report that just came out from Public Health Ontario, there's been a pretty clear line and indication that when the public health measures and the protections like the mask mandates were lifted on March 21st, we've seen an increased rise in cases and hospitalizations, especially over the last 3 weeks. So really ensuring that we're keeping masks in place for these high-risk settings, as mentioned, by Dr. Moore, when you're looking at healthcare settings, long-term care, other, public transport. But, it really is important that we also try to address some of the places where where masks aren't in place, and just how important this can be as one of the many layers or measures we have to try to get us through this wave.
Of course, the overall mask mandate was dropped several weeks back. Now, I'm curious to get your reaction to Uber dropping its mask mandate for riders and drivers. Similar to transit, these cars are, of course, a shared mode of transportation. What's your message now to riders taking Uber?
Yeah, I think that's a little overzealous and regrettable with Uber. I know we've seen some other rideshare companies or taxi companies continue to keep the requirement for masks. Given, again, what we know about COVID as an airborne infection and disease, really, I still think, given where we're at with the cases and the challenges we have still around testing and accessing certain parts, of the system and the stressors that are in place, I still think it would be, good guidance and good prudence to continue to wear your mask, especially in such a closed place like an Uber, and especially with the weather now being better, if windows can be down to improve ventilation. These are, again, potentially high-risk settings, and it's hard, I think, when we look at what Uber may be doing for drivers and people who are, essential workers that are without many benefits, without some of the protections in place that if they do get sick. So I really think for both riders and drivers, if there's ways to ensure that the masks are in place, I still think it's a prudent choice as we're navigating the next few weeks.
Now, I will say Uber is dropping this mandate, but they are recommending that riders and drivers still wear their masks. Now, starting Monday, Canada is easing border requirements, focusing on kids. Unvaccinated children 5 to 11 won't need to show a negative test. What message do you feel this sends to incoming travelers?
Yeah, I think we've seen mixed responses and some of the data around just how important some of the testing is in coming back. I think the major piece when we're speaking about kids and children in terms of the testing is, I would argue it's around the biggest focus should be in terms of what's happening in schools. We still are seeing, again, a increased risk, increased spread of a pathogen that we know can have really devastating impacts for children. There's lesser rates in terms of hospitalizations, but we've seen in the previous wave increases in pediatric hospitalizations and ICU visits. And we continue, again, to try to follow the science. I think this has been politicized as if the science is going to be so clear cut. The process requires us to continue to look at the data. It can be messy as we try to disentangle a lot of the data that's out there. But what's pretty clear is that kids being without masks in areas that are less ventilated in schools, not having access to the testing, these are real risks both for kids, for their families, for workers. And this is something where I think we need to have more focus and more protection in place.
Of course, we've talked about the other high-risk settings like hospitals and long-term care homes where the mask mandate is being extended, but it was dropped in schools several weeks back. I know the Toronto District School Board is recommending staff and students still wear masks, although it won't be mandatory. What do you think needs to happen? Do you think the mask mandate should come back for schools?
Yeah, again, I think we need to look at where the best advice and evidence seems to be. And when we look at a report coming out, again, of Public Health Ontario, it's clear that there's concerns about the transmission happening in schools. And again, we know that there's other evaluations that have shown some real important protections for high quality masks for kids, for children in schools. And again, I really think we have to push back against the notion of people trying to conflate mask wearing with lockdowns. That's not the conversation that we're having. That's not the measures that we're talking about. And again, in terms of wearing a mask, it being much less burdensome than some other potential measures that we've been through over the last 2 years. And I think we really have to be serious about the sort of masking that can help keep kids safe over the next few weeks. And I think, again, as we've seen the public health guidance, trying to get to landmarks where we're seeing us not be at potentially, the top of the wave. There's been some encouraging news that this might be plateauing, but we're still right in the sixth wave. And I think there's real moral and public health risks if kids continue to be exposed the way that they have been.
Now, Dr. Boozary, final question. Take us inside hospitals at the moment with staffing shortages connected to COVID-19. Are you concerned about the impact on care and more surgery delays?
Yeah, I think this is the other thing that we need to do a better job of with respect to public health messaging. Yes, it's about COVID and the spread, and that's been, again, shown to have an impact and when we've seen it lifted or when it's been in place and how it can start to blunt waves. But it's really important in terms of protecting our healthcare system. And what we've seen in the first few waves, what this was really about when we talked about bending the curve, it was about patient admissions and the system not having enough hospital beds. I think in the last two waves, we've seen a little bit of a shift where the focus has really been around not having the safety in place for health workers and for people having to become absent due to COVID infection. This having a real strain on an already strained and overburdened healthcare system. When you look at the data from a policy perspective, pre-pandemic, we already rank very low in terms of respect to hospital beds per capita when compared to our OECD countries. So we already have a predisposition, if you will, for any stressors to set back the sort of care that people expect and the high quality care that health workers across the province continue to step up to provide. But so part of wearing a mask is, yes, it's about protecting yourself and your loved ones, but it's ensuring that health workers who may be around aren't being infected as they continue to try to mask, as well as the folks who are immunocompromised and at higher risk. So we are worried in terms of what the impact is on the system, but this is where we really need to pull together and ensure that we're investing in the healthcare system. And it's not just about beds, it's the people. A hospital bed without health workers is just a piece of furniture.
Dr. Andrew Boozary, thanks so much for joining us on CP24 tonight.
Thanks so much, Scott. Welcome home.